Hi, welcome back. Today I am going to talk on Metapneumovirus or hMPV as it is more popularly known as. This has been in the news recently because of a large outbreak in China. So with COVID memory still fresh in our minds, I think most people are worried about a new viral infection outbreak and how it might affect them. Let me reassure you that this is not a new virus, and in most of the people in whom it causes an infection, they have mild symptoms like that of a common cold. In a small number of people with other health problems, it could cause more serious complications, and even in them it's not lethal. A small minority of these people might end up with life-threatening complications. I hope that is reassuring, and so there is no need to panic. Now let's discuss this topic in more detail. Like I said, this infection is not new. It has been known to be around for the past 60 years, causing lung infections all over the world, including in India. As pediatricians, we are used to seeing children with viral infections all the time, like RSV, influenza virus, parainfluenza virus, adenovirus, rhinovirus, or metapneumovirus. So we are used to seeing metapneumovirus coming positive occasionally, so it's not new. This virus usually affects people of all ages, but it is usually symptomatic in the very young, less than 5 years of age, or those who are above 60 years of age. The peak age of infection is thought to be around 6 to 12 months of age, and infection usually happens in the late winter or early spring. This virus is usually transmitted between people who are in close contact with an affected person or in direct contact. It is also transmitted by large droplets of respiratory secretions falling on surfaces or in other things like napkins or handkerchiefs, etc., which are called fomites. That it is not spread by gentle breathing or talking to somebody with an infection. So that should be also reassuring to most people. The people who have other health problems like serious liver, kidney, or lung diseases, or those who are immunocompromised, or who are having cancer, chemotherapy, etc., these are the people who are at high risk for complications from this infection. The symptoms of this viral infection, if it becomes symptomatic, is something called bronchiolitis, which is like a wheezing sound in very small babies, or it could be an exacerbation of asthma, or in some small number of people it could cause serious pneumonia, or very rarely a condition called ARDS. But in general, in most people it is without symptoms, this virus passes away, or very mild symptoms like that of a common cold. How do we test for this virus? Is by a throat swab and doing a respiratory panel test. But I think that is not required for most people. Now, how to prevent getting this infection or spreading to somebody else? The government of India and Karnataka have released a documentation saying do's and don'ts. So what we should do is to practice something called respiratory etiquette, that is coughing and sneezing responsibly. That is, if we have a mask, we should wear a mask. And if we are infected, practice social distancing, that is about 6 feet distance between people. And if we have cough and sneeze, to use a handkerchief or a tissue paper and throw it away responsibly. If we don't have and we have a sudden cough and cold, then we can sneeze or cough into the sleeve of our shirt or t-shirt, not into the hand, because we will be touching this to the fridge or the lift or somewhere else and spreading the particles to everybody else. So that is responsible respiratory behavior. Then avoiding crowds and also trying to prevent infection from coming home. So at home, if there are vulnerable people like preterm babies, or those who are very old, or those who have certain other health problems, we should try to prevent passing on the infection to them. So practicing wearing mask at home at all times would be also advisable. Today, several families have already been asking me whether their children could go to school or go by school bus or attend some parties or go to play groups, etc. I think if your child is well or if your family member is well, it is perfectly fine to attend all that. But in case you notice somebody else in that group is having cough, sneeze or not looking well, then it might be advisable to avoid that group, or if not possible to avoid, then at least to practice wearing a mask or social distancing. So that should be absolutely fine. So the bottom line is life goes on as it's normal with certain respiratory precautions to be taken at all times. Thank you.